Thank you for joining us for tonight's educational webinar on aging and arthritis. Tonight's speaker is Dr. Mark Gittins, OrthoNeuro orthopedic surgeon. Dr. Gittins is a board-certified orthopedic surgeon specializing in sports medicine, arthritis, and extensive experience in outpatient joint reconstruction, including robot-assisted knee joint replacement and direct anterior hip replacement. Dr. Gittins will answer questions following his presentation. Please type your questions in the Q&A box at the bottom of your screen. Dr. Gittins?
Thanks, Heather. Thanks for you all joining me. I think we got a few more coming in, so I'll kind of start here a little bit slow. We're going to go ahead and I'm going to share my screen and go over the talk, and then we'll have plenty of times if you want to ask some questions in the Q&A box. Please feel free to type those in. Hopefully, how are we doing there? I think we got everything shared there. And so we're going to talk about topics that I see in the office. And again, I'm somewhat biased because I'm a hip and knee surgeon and see a lot of people with arthritis of all varying ages. But we're going to talk about arthritis and aging and some of the things that I see. And you know, people ask questions all the time about this, and you know, some of the truth, and then some of the myth and the folklore that may be out there. And again, some of the research that really has kind of changed us to our treatment programs at this point. So we certainly know, you know, over half of Americans have some form of arthritis. It is a big disease. We are affected in numerous ways, where it affects everything from our sleep to our work to our recreation. So it's a big deal. And obviously there's rheumatoid arthritis, there's psoriatic arthritis, and then there's, you know, osteoarthritis, which is the good old-fashioned, most prominent wear and tear arthritis. So arthritis affects us all. Sadly, there is no cure for arthritis, and it will progress. What we can control really is the progression of arthritis, and ideally we try to make that slow versus fast. So we know there's some things that do speed it up. We try to mitigate those, and certainly we have answers when we do get end-stage arthritis that are remarkable and life-changing. But during the process of this, as we get older, we all tend to get sick, and we all to get birthdays. And so how do we handle those? So here's some just tips what we talk about with people on how to keep your joints healthy, things to kind of do and things not to do. So the biggest thing is to keep moving. I've had some people say, well, I shouldn't work out. I should just, you know, be more sedentary. And that's probably wrong. You want to engage in some type of exercise program on a regular basis, you know, 4 or 5 times a week. You'll want to do this. Yoga is great, some type of movement, stretching. You need to keep your joints moving. They tend to do better with movement. That's how they actually nourish themselves. So as the joint and the lining on the joint, the cartilage on the joint is moved, it nourishes itself. So we really do strive to try to keep people moving as much as we can. Have you ever noticed animals too, if they are kept in a pen or in a barn, they tend to limp a little bit because their joints aren't moving. So you will become less painful if you move your joints. If you have arthritis, then you may have to be a little bit more creative with that. So maybe it's more on a bicycle, perhaps it's in a pool in the form of water therapy or water aerobics. Certainly, when you know if we're moving, then we're going to have better muscle strength, more muscle memory. And a good thing is that it increases your caloric intake, so it keeps your metabolism going. So you want to fight the urge to be sedentary and sit in a chair. So try to figure out a time in your schedule that you can do something basically every day of the week. And there are some studies that show that people that do that, no matter what part of the world you live in, tend to do better and they live longer. And so try to look for those activities. Again, there are some areas in the country where people do remarkably well around the world, and they're all have the same thing in common. They're all activity-based people. So how do you protect your joints? You got to listen to your body. So if something's hurting, you certainly don't want to just plow through it. That's where you may need to seek medical attention from your local orthopedist or your primary care physician. Avoiding chronic stresses, you know, doing the same thing every day all the time can be a problem. That's how you get stress fractures. Watch your body mechanics. And so you look at the diagram here. If you look at people, I tend to look at people and their posture. We have a lot of people that have poor posture, and that does increase the stresses on their hips, their backs, their knees, and their ankles. So Working on your posture, and again, that goes with your activity levels, can help you do this in a more efficient manner. Sometimes employing a therapist, a physical therapist, can help you on this. Certainly, we tend to get a little bit weaker in the core, and that's one of the areas that we can first function on with core exercises to keep our posture better. Try to get your sleep and try to get it at the same time every day. So some of the studies have again shown if you're a night person, that's okay. Just make sure you get that good 8 hours of sleep and try to start it and stop it at the same time. If you do have a limp or need assistance, don't be afraid to use assist devices such as canes, crutches, walkers. If you need to have a parking permit, those are readily available for people with arthritic. And the last thing is something called BMI, which stands for Body Mass Index. And that's a calculation, although it's not perfect, but it's all we have at this point, that tries to look at some of the fitness that our patients have. It's really mandated by CMS, Center for Medicare and Medicaid Services. It puts us in a box of how we are and how we're doing with our body composition. A lot of people ask me, well, how do I know my BMI? How can I check it? How do I evaluate it? And this is how it is done. And you can just look this up on your computer or your phone. And basically it just has a height and a weight. And then with that, you can calculate your BMI. So if you find out what your height is and then your weight, and it will change, every time you weigh. I don't think much of us are getting taller anymore, but you do get a little bit shorter as you go through life. So it does need to be monitored. The challenge in the state of Ohio certainly is that we have a large population that does have stressed BMIs where they go into this overweight, obese, and morbidly obese categories. So those do accelerate your arthritis, and they can prohibit interventions because of the BMI being too high. There does appear to be a high correlation with high BMIs with diabetes as well. So, in general, if you can keep the BMI down to the healthy range, you're just going to do better and live longer. So people ask about what exercises should I do, and again, these joints are really made to keep moving. And so anything you like to do, you got to make sure you like it. You'll want to do it. Swimming's an excellent exercise, and so you can swim or you can just walk. Some people, I don't like to swim, I don't know how to swim. A lot of the rec centers and the Ys still have rec opportunities, and you can get in there and just walk. You'll still get the movement. You don't get the pounding. It's low impact, and your joints will be better for it. So look for water aerobics, water Zumba. Golf is an excellent one, and I'll put golf in the same category as some of the racket sports. We're basically looking at something and swinging something to hit it. So you could say like golf, pickleball, tennis, even ping pong. Those are all exercises we're now seeing that tend to have longevity associated with them. So there's something in that with the coordination, looking at something and swinging to hit it, that people do better. They have better strength, better balance, and frankly, they're living longer. So golf would go into that one as well. Just generalized walking, and that can be around your neighborhood, or as we get to the winter months, you might want to go to the rec center, or you can get creative and just do it at one of the local stores and just do laps in the stores before you do your shopping. You just have to be cognitive and think about it. Where can you do it? Certainly cycling, whether it's recumbent or standard bike, and it can be a moving bike or stationary bike, are all good. Again, that really helps a lot with your knees and your hips. It can help you with range of motion, especially kind of see that more in the recumbent bikes because you have the back of the chair that may support you. Dancing and yoga, we kind of lump those together. I think those are excellent opportunities. You may not be flexible and you may not have any rhythm like myself, and you probably need to be in the back of the room. Studies do show, though, if you have stretching and rhythmic activity, those people do well. They have less chance of falling. So think about these things. One, keeps you healthier, keeps your joints healthy, but it also prevents falling. Muscle strength, as we get older, you hear about something called osteopenia or osteoporosis, which is loss of bone as we get older, but we also tend to lose muscle, and that's called sarcopenia. So you don't have to be like the guy on the left, but you could be the people on the right, where again, you incorporate some type of muscle strength. Now, this will help your muscles, but it also gives weight bearing to the bone and can also help with, again, the osteoporosis. So as we weight bear, our musculoskeletal system tends to do better and creates more bones. You have less chance of fracture. People always ask me about the diets. What can I do for my diet? Well, make sure the diet fits into your BMI scale, right? Because a lot of us do get a little more sedentary, don't burn as much calories as we once did, and our metabolism is less. So it's easy to get up on the BMI scale. So make sure your caloric intake, it's just a math problem, is in the right zone. But then some of these Mediterranean, if you look at some of the diets out of Loma Linda or Italy, where fishes, nuts, avocados, simple oils seem to do pretty well. And again, they have less inflammation associated with them. If you are afflicted with a gouty arthritis, then you hopefully already know that, one, you may need to be on medicine to help with gout, but two, the dietary intake, which needs to be really high in a lot of fluids, but then trying to avoid foods that have what's called purines in them, heavy eggs, caviar, steaks, red meats. You probably need to avoid those. So those are simple things. And again, depending on your own situation, you can investigate that a little bit more. So bone health, we talk about bone health, and I mentioned it a little bit before, is osteoporosis. And so osteoporosis, if you look at the diagram at the top, you can see the bone becomes dense. And then as we go through older age groups, then you tend to lose some of the calcium as you go from the left to the right. So as it gets more porous here, then it's easier to break. It is associated with gender. So females tend to get this more than males. It's also associated with ethnic groups. So we tend to see it more in the Asian and Caucasian populations. It can be associated also with tobacco use and steroid use. In Ohio, we tend to get a little bit of a struggle here because we have so many cloudy days, although we've had a wonderful fall so far this year. And so we don't have as much vitamin D. So some people say, well, I won't have osteoporosis because I take vitamin D and calcium. My question always to that is, are you monitoring it? You wouldn't take a blood pressure medicine and then never check your blood pressure. So I saw some people this week that were way overdosing on their vitamin D. So if you are on this, you may need to be on it. You at least need to ask your primary care physician, what are my levels and what do I need to do? So if your calcium is low, you probably need to take some. If your vitamin D is low, you probably need to take some. But then you need to go back and check and see how you're doing with that. Annual examinations, most females are associated with that, with their mammograms and general annual exams. For the bone health, it's every other year. And so both males and females probably should get what's called a DEXA, or bone density test. Dexitometry is what it is called. And that really is just a number that tells us how good of bone you may or may not have. It's just the number. It's not an end all be all. So there will be people that have a average DEXA scan, but they get a fracture, and I'll tell them they need treatment for osteoporosis, and they get confused and understand, well, why? My DEXA scan is fine. We don't treat the DEXA scan as a number. We treat osteoporosis to prevent fracture. So if you've had a fracture, we don't really even need a DEXA scan other than it's a monitor tool. We know if you're breaking, you shouldn't break. If you're breaking, you have osteoporosis and you need treatment. And it's usually, if you've got a fracture, it's going to be more than calcium or vitamin D. There are some medications that are out there, but if you're starting to break, or you're having wrist fractures or back fractures or hip fractures or ankle fractures, you're probably going to need to be treated for your osteoporosis. But again, you can talk to your primary care or your orthopedic surgeon about that. Another thing that we do in this bone health is really prevention of these fractures, and that has to do with falls. And so I talked to you about balance and such like that. So fall prevention is going to be a big topic that we'll talk about with the dance section. Another issue is nicotine use. Again, we see more fractures, more osteoporosis, poor healing of fracture and wounds, and even so much that it starts making lumbar spine problems worse, of the low back. Some of the insurance companies now will not even authorize surgeries of the lumbar spine if there's nicotine involved, because the results are so poor. So even though it's hard, you'll live longer, and it's probably the best thing you can do for your health is to get rid of any tobacco. So I'll talk about the last one, and it's dance, dance, dance. Again, this goes with movement, but this is rhythmic movement and balance. And so dancing, no matter what it is, whether you're coordinated or not coordinated, any type of dancing with rhythm, stand in the back like me because you have no rhythm. And Tai Chi is another one. So sometimes they'll call it a balance class or Tai Chi. Anything with balance and movement. Yoga kind of fits in this, but Tai Chi is actually shown to be better in yoga on the balance things. Again, they tend to prevent falling. Why is falling so bad? Is that it frankly kills people. Last year, it was basically tied a little bit above flu deaths. And we talk about the flu all the time, and you hear everyone, right now, you're starting to hear about we should get flu vaccines, but you really should be also thinking about falling. Just as many people die from falls than the flu, and actually it may be a little bit more. So it's the #1 cause of traumatic brain injury in adults, and it does kill people. So things you can do to try to prevent falls, since we don't do a great job of fixing falls, right? That's us putting plates and screws. We'd certainly like to prevent them. So, look at your home environment. Are you well lit? Do you have throw rugs? Do you have cords? Do you have pets that get underneath you? Do you have assist devices, and should you be using them? Those are all things, just looking at your environment, that you'll want to take a look at. People think, oh, I only fall on the ice. The falls are in the home, falls occur. So again, look at your environment, and then working on your balance. We tend to lose our balance as we get older. I tell people it's like playing the piano. How do you get better at that? You practice. How do you get better at keeping your balance? You got to practice. And so dance, rhythmic activities, and Tai Chi are really helpful with that. So with that, that's just a glimmer of some of the topics that we see in helping your joints. And I'm happy to try to answer some of these questions here. So give me 1 second.
So do you want me to ask them to you?
Sure, if you'd like to.
Sure.
Am I doing okay am I still sharing, or?
Nope, you're not sharing. You're back to your normal screen.
Back to live. Okay, sorry about that. Thanks.
So the first question is, how does sleep affect my arthritis?
I don't think sleep directly affects your arthritis, but we, again, see this total kind of inflammation response that we see when people have kind of raggedy sleep. And there are a lot of people that really struggle with sleep. There's a whole specialty, sleep medicine. But what we want to try to get to is very rhythmic sleep. Even some of your smartphones will do that. Obviously, sleep apnea interrupts that. Obesity can interrupt that. Gastric digestion can interrupt that. So we do want to try to get to a point where, again, for general health and lack of inflammation, that you're pretty much going to bed at the same time, waking up at the same time, and not having interrupted sleep. So it gets a little more complicated because it may involve other specialties in it, such as pulmonology, neurologists, and sleep medicine experts.
What is a good BMI?
Oh, it's a great answer. So from a surgical standpoint, it really has to do with your health, but you'll want to be down to the 30s is what you want to do. And you can look at the graph. It's on the computer or your phone. Look at a BMI, put your height, and put in your weight. From a surgical standpoint, we really want people down to 40. We're seeing a significant spike in infections. And again, all day long, that's all I do, is put in new hips and new knees. And the people that get into trouble, the people that have infections, have BMIs above 40, can have hemoglobin A1C above 7. Their wounds just don't heal. Their soft tissue is not as good. So it does affect your health. So you'll want to definitely, if you're considering a surgical option or time, you do everything you can to be below 40. But from just day to day, you'll want to be able to try to get it down to around 30 if you could.
Thanks. What are some moderate impact exercises that I can do without hurting my knees?
So moderate exercises, again, it kind of depends on you and how bad your knees may hurt him, but simple things like walking, and I encourage people to walk outdoors versus walking on a treadmill. Try to mix it up, an elliptical, a bicycle, swimming is good. Yoga, weight bearing exercise such as weightlifting, squats, those are all, you can mix them up and use all of those. The treadmill can be used occasionally. People ask me, I mean, that's easy, right? We can just get to it, but I do see more stress related injuries from chronic use. And I think that can be a problem. And the reason is because the treadmill pretty much comes at you at the same speed all the time. And when it's with you at the same speed, you tend to put your foot in the exact same place at the exact same cadence, and I see more stress fractures. So I try to, if you're going to use the treadmill, don't use it every day, use it every once in a while. I really favor people. I think mentally they do better by getting outside and see the leaves change. Their stride pattern is a little bit different. They take bigger steps, they take smaller steps, they cross the street, they talk to a neighbor. I think that's all kind of a more beneficial way to walk and get some cardio that way.
Great, thank you. How do I improve my bone health?
So, the easiest way is never to have a birthday, right? So as we get older, we tend to lose some of our bone health, but it is a decline, more so in the female than the male. And then if there are any hormonal issues or steroid issues or tobacco issues, they make your decline even more rapid. So ideally, you want to start with a high bone density. And again, you can't pick your gender and you can't pick your ethnicity, but those are some of the risk factors. So I think you need to be aware of those. And then again, have your primary care, look at your calcium and your vitamin D, and then make sure you have a good exercise program that does include some weight bearing. So it doesn't have to be necessarily with a bunch of weights. You can just do your body weight and do squats and do curls of even canned foods. There's all kinds of things, but some type of body weight exercises will be helpful. Do not smoke. Do not take steroids if at all possible. And then check your calcium and your vitamin D. If you do have a fracture, most likely, again, you may need some form of treatment more than calcium or vitamin D.
How do I test my balance, and what's the best way to prevent falling?
So balance, sometimes just ask the people that are with you, how do I look? Do you look wobbly? Do you feel like you're wobbly? Have someone take a video of you and look at it. Do you look wobbly? Do you look like your posture is good? Are your shoulders way in front of your knees? Or are you sitting upright? So those are things that you can look at. And then, simple exercises like practicing. And so Tai Chi is one way you can do it. Dancing is one way you can do it. You can time yourself. So get an egg timer or something and time yourself trying to stand maybe next to a kitchen counter on one leg and having the counter to support yourself. See if you can get to 15 seconds, see if you can get to 30 seconds, and then try to get to the other leg. So those are simple things you can do, but certainly the things that have helped that we've seen in studies that prevent falls and increase balance are Tai Chi and dance. And then, the other thing is some type, if you can advance, then you can go to some type of racket sport where you're hitting something with a ball. So whether that pickleball has had a big surge here recently, golf, tennis, ping pong, just batting a ball back and forth, anything where you're seeing something and then using your arms and your body to move it to another direction, I think would be beneficial.
What over-the-counter supplements, if any, can help?
It's a great question. And, I see all kinds of things attempted out there. Probably the most common thing that I see is that people want to take glucosamine and chondroitin sulfate. And there's never really been a study shown that that's really going to help you. I don't see people really getting hurt by it except for their pocketbook. But it's really not going to prevent anything that we've seen. Again, the things that I've seen from an arthritis standpoint, if that's what you're referring to, is again, keeping the weight down, do not smoke, and do this regular exercise program. Some of it's based on your genetics, and again, you can make your situation worse. But over the counter, a good normal healthy diet. I think the Mediterranean, or some people will call it a blue zone diet, tends to help pretty well. But I don't have any strong recommendations that I've seen in the literature. If you take this, it'll prolong or prevent. I don't see that out there.
Why do some people get relief with cortisone injections while others do not, or not for long? How do you feel about those injections?
That's a good question. It is a hot topic. And so I think you have to look at the literature. And back in the day, it was very commonplace. And in fact, that's all we really had to offer people was corticosteroid injections, cortisone injections, and put me back in, coach. There have been some studies now that we've looked at the people that we injected, and I hear all these stories. Oh, I come in every 3 months, I get every 6 months. And we are making those people actually, believe it or not, worse. And so corticosteroids inside the joint, for the most part, actually will accelerate your arthritis, accelerate it. You may get some relief, but if you do the studies and you follow these people out 1 year, 2 years, you're actually making them worse. You're accelerating their arthritis. You also increase their osteoporosis. We talked about that a little bit. So you're making that worse. If they have diabetes, you may be elevating their hemoglobin A1C. And then lastly, if you do contemplate surgery, your chance of infection is going up with the injections. And so I'm becoming less and less of a proponent, not that I never do it, but it's getting close anymore to a never, on the steroids, because we have better options. I think the viscose supplementations in the knee joint is something that's FDA approved. The statistics on that are about 70%. So 7 out of 10 people get better, 3 out of 10 don't, but it doesn't really make your knee worse. So that's something that you can consider. So I think that's where I'd point you at that point. But once you become bone on bone, I think the chances of injections really become quite diminished at that point.
I have had multiple orthopedic surgeries. What do you think about eating meat occasionally or gluten in a diet? I do not eat dairy due to intolerance.
Yeah, I don't think, and again, some of the reading I've done with some of these Mediterranean diets and blue zone diets, I mean, it's okay to eat some of it. I have some people that eat it all the time. It depends on your system. If you're not able to process dairy, as you perhaps mentioned, or you're not able to process purines, well, then you got to stay away from those, because you're going to end getting more inflamed. So I think it's, again, eating a normal balance. I wouldn't say eat meat all the time, but if you can eat some vegetables, or if you like to go to a gluten diet, I don't think there's been anything that's shown that that's bad, but I think you're going to have to do it in, a regular fashion and not try to binge with it. I don't have any problems with someone saying, oh, I eat meat. Again, unless you have a purine insufficiency, and you probably have to go to more white meat or chicken if that's the case, or more fish products there. But again, each person's going to be different on that. And again, I think probably more your genetic makeup and how you process food. So we all kind of know what we like and what we don't like.
What is your opinion on human growth hormones?
So human growth hormones, they're out there. I think you have to be careful with them. They can be used in the right fashion. If you're trying in a sarcopenic patient, I think they work well, and that may be something that you want to do. If you're a young, healthy person and you're just doing them so you can get stronger, there have been some studies to show maybe that's not the healthiest thing to do, because we probably overstress our system, including livers and tendon issues. So I think there's a place for them. I think you just got to find the right place. I don't think they're for everybody.
Are there any additional questions? Thank you very much, Dr. Gittins.
Thank you, everyone. I hope you have a nice evening.
Thank you for participating in tonight's webinar. Our final webinar for the year will be held on Tuesday, November 7th. Dr. Ranjit Ganguly will be speaking on minimally invasive spinal surgery. Enjoy the rest of your evening. Good night.